Hello, and welcome to
Dr. Brainwaves.
This is Dr. Azar. I'm Dr. Rochelle, and we're going to be talking about an extremely important topic today that affects women, postmenopausal bleeding. The reason why this is such an important topic, not just because it can be extremely annoying, but because 10% of women who have postmenopausal bleeding, it's due to cancer. So we also know that early diagnosis is extremely important because it improves survival. So Dr. Azar is going to fill us in some of the details regarding postmenopausal bleeding, how it's diagnosed, what we need to do about it, and how we can keep you empowered.
So I discussed on another talk about menopause and how to know that somebody's menopausal. So if you know you're menopausal and you're having bleeding after your menopause, that is not right, and you need to bring that to your doctor. We also recognize that you need to come to your doctor if you have just an unusual discharge that will not go away, because sometimes discharge can be related to early signs of cancer. And that's probably because the cervix is a little closed and some of the secretions of the uterus may be escaping without letting obvious blood out. And so they can still have an underlying cancer that we need to be looking for. So as Susan already said, 10% of people that have postmenopausal bleeding will end up after workup having some type of cancer or precancer in the female reproductive tract. So when you first go to your doctor with menopausal bleeding or postmenopausal bleeding, you're going to be checked out with an examination to make sure that the uterus looks like it's causing the bleeding. Sometimes people have bleeding from the bladder or from the rectum, but those types of bleeding can be sorted out with a physical examination. And I will say sometimes people come to me and they have had bleeding and they're not sure where it came from and it's no longer occurring. Most of the time when women feel like it's coming from the vaginal area and likely from the uterus, most of the time they're correct. So when you get worked up for menopausal bleeding, the first step is going to be getting an ultrasound. And getting an ultrasound allows us to look at the uterus, tubes, and ovaries. And when we see those structures, we can see if there's any obvious enlargement, tumor, etc. But we're also looking at the lining of the uterus to see how thick the stripe of the uterus is. So the lining of the uterus is called endometrium because we have big words for everything. And so the endometrial stripe in a postmenopausal woman should be less than 4 millimeters. We used to say 6, and then we bumped it to 5, and now we say 4. So the lining of the uterus can be thickened from other things. It can be thickened by a fuzzy overgrowth called a polyp, which sometimes postmenopausal women get and are rarely becoming some kind of cancer. But they can nonetheless cause the thickening to be present in the canal of the uterus and not be specifically cancer. Also, people can have fibroids in the lining of the uterus, as well as in the muscle of the uterus. People can also have some changes in the stripe of the uterus because perhaps they've modified the types of hormones that they're taking, either dosage or type of hormone, or rarely will even find an underlying problem like a thyroid abnormality that is now affecting your body's ability to absorb the estrogen that you're taking as a hormonal replacement therapy. And now the lining of the uterus, which responds to estrogen and gets thicker in the presence of estrogen, is overgrowing and causing some bleeding. So those are some reasons for a thickened endometrial stripe presenting as postmenopausal bleeding that are not cancerous. Rarely, but sometimes people can actually have a cancer in the tube or the ovary, which is further up inside, obviously. And the ultrasound can help us to look for that. I do like to put out there, since the focus in any discussion on postmenopausal bleeding is evaluating the uterus, that some consideration should be given to either removing the tubes and ovaries or further follow-up on those, because occasionally, as I've mentioned, those can be the source of postmenopausal bleeding. And they don't always show signs on an ultrasound of having that abnormality. Unfortunately, in the last couple decades that I've been in practice, I've had a couple of patients that had normal-looking ovaries and ovarian cancer, which presented as postmenopausal bleeding. So that's a consideration as well. So to sample the lining of the uterus, we can do either an office biopsy, which is something that is clearly convenient because it's done in the office. It can be a little uncomfortable. There are medications that can soften the cervix to allow that biopsy to be a little bit easier. And you can also take an anti-inflammatory to help with the cramping associated with that biopsy. That biopsy is convenient, and we do it with a little Pipelle straw to get a sample of tissue, but it is only a small sample, and we recognize that it can miss cancer in about 10% of cases. So that has to be a consideration when you rely upon that to rule out a cancer. In addition to, or alternatively, people can have a D&C, which is where you go to sleep and we actually put a little scope in and do a hysteroscopy to take a look in the canal, look and see if we see an area that's suspicious, look and see if we see a fibroid, for example, sticking into the canal that can cause postmenopausal bleeding. We take the scope out and then we do a nice thorough clean out, and that is unlikely to miss a cancer. However, I'm going to say another caveat is that if you have a thorough workup and you continue to bleed, you probably just need a hysterectomy, because no detection method is 100% sensitive to pick up a cancer. So those are some of the details that we look for and details about how we investigate cancer of the lining of the uterus. I guess I wanted to mention, which I didn't before, that the 4mm stripe cutoff is convenient to know, but don't get horribly worried if your stripe is a little thicker than that, because the cutoff at which we know somebody definitely has a cancer is 40mm. Pretty big difference there. So if you're in that gray zone, we're just checking out for cancer. And really 90% of the time there is no cancer, but 10% of the time there can be. And the important thing to know also about cancer of the lining of the uterus in particular is that that cancer tends to be, by far and large, a slowly progressing cancer and not very aggressive. And we are really good at curing that, oftentimes with just a hysterectomy, not even needing chemo or radiation. So it's really, really important to come in as soon as you have postmenopausal bleeding so we can check it out.
And a question I have for Dr. Azar is, why is it important for them to know the stripe? Is that the way it would be described on their ultrasound report? How would they know that there is a stripe in their endometrial lining?
How would the radiologist know that, or how would the patient? The patient doesn't know necessarily. It's just something that we look at radiologically that gives us a little index of suspicion. We might use that information like this. So if we have somebody that has a really thin stripe and they're having bleeding, and say their stripe is like 1mm, and it's maybe a small amount of bleeding, and they had a recent change in their hormones, our suspicion is going to be significantly lower for endometrial cancer. It wouldn't mean that we would dismiss it, but it might make us feel like, hey, we can do an endometrial biopsy, or perhaps we can do a repeat ultrasound. Alternatively, if that same patient presents little change in their hormones recently, but their endometrial stripe is, say, 15mm, we're going to say to ourselves, that's likely not to be just from a change in your hormones. So we're going to get in there and check that out more assertively. So that's how that piece of information can be helpful.
Thank you. So here you have it. Endometrial tissue releases some of the blood that comes out, and it can be completely normal if you haven't gone through menopause. But after menopause, you really shouldn't have a lot of bleeding, or any. And if you do, go see your specialist to have it evaluated immediately. Again, the key is to get in there sooner than later, so that if there is a cancer, only 10% chance, but if there is, we can catch it early.
Absolutely. Thanks for your time, and look forward to seeing you again soon.